Good afternoon, everyone. Welcome to our October membership meeting program. Today's program about the COVID-19 pandemic, which we are still, sadly, in the midst of for about 8 months now, will provide you with a brief recap about where we've been since March, from shutdown to phase 1 and our current phase 2 standing. We'll highlight the efforts of the Douglas County COVID-19 response team, community partners, businesses, and citizens. Today's program will take a look at where we are now, discuss the recent uptick in positive cases, and what we, as businesses and community leaders, need to keep doing, start doing, or stop doing to ensure we move forward successfully past this pandemic. Finally, we hope for a little forecast about where our presenters believe we're going and what we can expect in the remainder of 2020 and into 2021 in this very unexpected world we live in. Before we introduce our two distinguished presenters, I would like to give a shout out and thank you to CSO Financial for sponsoring our October program. CSO Financial is a proud, long-standing member of the Roseburg Area Chamber of Commerce and a regional leader in collections, recovery, and receivables management services for over 100 years. With 5 locations, including Grants Pass, Eugene, Corvallis, Lebanon, Coos Bay, North Bend, and headquarters here in Roseburg, CSO sets the industry standard in client service and consumer protections with the latest in technology and training. When Oregon businesses need help collecting overdue, delinquent, and unpaid accounts, and what business doesn't need help from time to time, they turn to the professionals at CSO Financial. Because at CSO Financial, the bottom line is your bottom line. So again, our thanks to Mary and Matt Inscore and the entire team at CSO Financial for their continued support. Be sure and check out the great services they offer. For those joining us for the first and as a reminder for those with us last month, we will have the presentations from our guests first and then questions at the end. Our viewing attendees may type the questions in at any time during the presentations. I will then present the questions aloud so all our viewers can hear the questions asked today. So let's get started. Our presenters today are Douglas County Commissioner Tim Freeman and Dr. Bob Dannenhoffer, Douglas County's Public Health Officer. Commissioner Tim Freeman is in his second term as a Douglas County Commissioner. Commissioner Freeman is in his third term as the President of the Association of Oregon and California Counties, serving since 2016. Prior to being elected as Commissioner, he served as our Oregon House District 2 State Representative from 2009 to 2015. Before that, Tim was on Roseburg City Council from 2003 to 2008, serving several years as Council President. All this while operating a small local business. To say Commissioner Freeman's list of civic and community organization involvement and services is vast would be an understatement. Tim is a recognized leader in ONC land management issues and is also acknowledged for his work on behalf of local business, public safety and law enforcement, veterans, public health, and the creating of a transparent county government. Dr. Bob Dannenhoffer is a practicing pediatrician and the public health officer and administrator for Douglas County. After completing medical school at Albany Medical College and his pediatric residency at the Massachusetts General Hospital, he served in the U.S. Navy. He has been practicing pediatrics in Roseburg since 1989. Dr. Dannenhoffer has been deeply involved in Oregon's healthcare transformation journey and served as the CEO of one of the initial CCOs and as the chair of the inaugural Metrics and Scoring Committee. At the OMA, Bob is a past president and a delegate to the AMA. He served as a co-chair on the Task Force on Resolution of Adverse Health Care Events. He currently serves on the Public Health Advisory Board, the Governor's Medical Advisory Panel, and the Healthy Schools Reopening Task Force. And of course, he is the gowned, gloved, and masked face we have all come to know well from Facebook Live COVID-19 Q&A. Up first, please join me in welcoming Commissioner Tim Freeman. And I will note this is a re-recording of this introduction as we had a technical issue, mainly not pressing the record button, when we had our first go around of this. So apologies for that, and apologies to Commissioner Freeman for joining him partway through his remarks, but we got the majority of it, so hope you enjoy. All right, thanks. Tim, you're up.
Center here at the county. That emergency operations center had was set up and had our first meeting at the end of March. So very quickly were we up to speed. DPHN had already been working on this as the public health contractor for quite a while, but the county figured there was some work that we needed to do. I'll remind everybody, Douglas County is the public health authority, and in that role, we have quite a bit of responsibility, so we've taken it pretty seriously. So a lot of people have seen our update. It comes from the Douglas County COVID response team. That team is made up of 42 members representing 9 different organizations here in the county. One of the hallmarks of the new delivery system that we have for public health here in Douglas County really is a community approach. And we treated and are continuing to treat this emergency and the way we're going to address it very much as a community approach and a community team to respond. We quickly established objectives through our Douglas County COVID response team, and I'm going to read those. I'm not going to read a bunch of stuff today, but I do want to read these because they were timely when we established them all those months ago, and they're still timely today, and they're still a guiding light for the work that we do here at the county. So the first thing we talked about was minimizing loss of life for Douglas County citizens through education, mitigation, and containment. Second thing was to protect the medical systems from being overwhelmed with cases by coordinating long-term strategic response plans and identifying local thresholds with appropriate local response. Third thing was ensure safety to healthcare providers by facilitating the acquisition and distribution of available personal protection equipment by utilizing local, state, and federal resources. The fifth thing was to ensure appropriate and timely coordination and communications to cooperators and the public. And then finally, support operational needs by leveraging and using Douglas County resources. So those set of objectives have really guided this team in the work that they've done. And I will tell you, there's been an amazing amount of work at the county done so far. And again, we're still right in the very much middle of this response, and it continues. So people often forget all the different things that county government provides. So we quickly established really a core functions of county government and then used other functions of government staff to make sure that we were completing those core functions. And things like making sure our seniors' meals were delivered is a great example of understanding the need to continue to do those things that the county did on a normal basis while responding to this emergency. So there was times we had staff from all kinds of different departments helping deliver meals to seniors. Seniors were very much and are very much a vulnerable population in this pandemic. And traditionally, our delivery system is through volunteers that are primarily made up of seniors. We knew that delivery system would not work. We could not expose the senior volunteers to COVID, so we had to make adjustments there. But I will tell you, the entire county, to every single staff person we have here, stepped forward and did exactly what was best for the citizens of the county, and I could not be more proud of the work that they have all done. We're very fortunate here at Douglas County as we put together our emergency response team to have many community organizations step forward to help us. We also have some amazing talent here at the county. So Douglas County has a very long time serving emergency manager. Wayne Stinson has been doing emergency management for decades, and his knowledge and experience has been incredible as we've dealt with the emergency of COVID. Going through the list, I'm not going to read all of them, but a couple folks that really stand out. So Casey Bolton from Aviva Health, we sort of begged him, tapped him, assigned him to be our incident commander because of his administrative role in healthcare and his knowledge and his past work in the military really led him to be the right person to be in charge of the incident. So through an incident command structure, that's the role he plays. Myself and the other commissioners were the agency administrators, but we also had help from sort of unlikely sources. So, and over the last 5 weeks, we've been very focused on fire. But prior to that, when we were setting up our incident command, Pat Script from the Douglas Forest Protection Association was kind enough to come over and be a part of our COVID response team. And very helpful in structure of how to get this many people working together for a common goal. And then again, I'm not going to go through all of them, but many of the county department heads, from our finance director to our facilities director to our public works director, all have been very much a part of the work here. And probably one of the most important pieces that we've been able to support here at the county and the work that DPHN has done is public information. So the county has a public information officer, Tamara Howell, and Tamara has taken on the role of running the Joint Information Center, which is made up of quite the group of who's who of public information around the county. So again, we've got 9 different organizations that are part of the response team, but the public information work that they all are doing together is pretty incredible. So I had them just for fun, get me the numbers. So how much information have we sent out? How are we doing? How are we doing about, giving the information that people would like to have timely? So as of this morning, the total amount of press releases coming out of the information team, which is led by the county here, but lots of support from all the organizations, is 305. So they've sent out 305 press releases, newsletters about information about this pandemic. And then Alan mentioned a little bit ago about the Facebook Lives that we've all come to enjoy and really appreciate. So Dr. Dannenhoffer has now done 66 Facebook Lives, and it is something that a lot of people in this county watch and use to get their information. And as part of that, he's able to answer questions specific to what's going on in a timely way. As many people know, this pandemic is evolving. I don't know what other word to use, and that what we believe to be true at the beginning, some things remain true, other things have changed. And I think the importance of giving the most accurate current information is vital. Before going to DPHN, there's one little piece about the response team that I mentioned, and it's still also, I want to mention that it's still true today. At the very beginning of putting together our emergency response team, I told everybody that there was no way to get this right. And I know that sounds kind of funny, but I told them that because there was simply no way of knowing how big a thing this was going to become and what was going to be needed. So what I asked for, and what the direction from the Board of Commissioners and myself were, is, you're going to do one of two things. Either you're going to do not enough, you're not going to take it serious, and the thing's going to get away from you and you're going to be blamed for not doing enough. Or you're going to do too much and it's going to turn out not to be a big enough problem and you've put too much effort into it. And I mentioned the group that no matter what, one of these two things are going to be an outcome. And I will tell you, somebody mentioned to me after the meeting there was a third possibility, that we would do a lot and it still wouldn't be enough, and they were right. So what I told the group at the time was, do everything you can do. And if it turns out that we didn't do enough, we can at least say we did everything we could do. And I think here at the county we have. To date, we've spent over $1.5 million of unbudgeted, unanticipated spending, and we have probably very likely that much that we'll do again over the next few months until there's a vaccine, maybe longer, maybe it's 6 months before there's a vaccine. But the commitment from the county and from the Board of Commissioners is this is an emergency, it's a real emergency. And we are, again, the local public health authority, we are the authority and we have the responsibility. We're going to make sure we can do whatever, we are going to do whatever we can to help the community through this. So real quick, I wanted to talk about Douglas Public Health Network and sort of the history of Douglas Public Health Network and how amazing they're doing. And then I'll hand this off to Dr. Dannenhoffer. So Douglas Public Health Network really came about because when Commissioner Boyce and I got here to the county in 2015, the state of Oregon had a crisis response team assigned to the county in reference to public health. And I think prior to us taking office back in 2015, the county had given back the mental health authority I think there was a fear at the state that they were getting ready to give back the public health authority. So when I got here, one of the first things that I was assigned to was to try to develop a public health system that provided for the best public health services with the limited amount of funding the county had to invest in it. So we worked hard on that. And I will tell you, on my whiteboard here in my office, we wrote sort of an idea up on the board, and I had a lot of people come in and visit with me, including Dr. Dannenhoffer. And collectively, we came up with this type of public health delivery system that's different than the other counties. And I really call it a community or a county facilitated community delivered system. And that is where the county retains the public health authority, but the services are done with community partners. And primarily the Douglas Public Health Network, they've got a list of program elements in public health that they're contracted with the county to provide those services. The state helps fund that, the county helps fund it, but ultimately Douglas Public Health Network is the organization. It's a nonprofit that is providing those services. Now, on a normal day, they would have 5 or 6 employees, and they would have some degree of disease in the community to deal with, and some preparation that they're doing, and some planning for problems and preparedness, and some communicable disease, and some school immunization issues. And but they would do pretty good work, and there's a great team there. Well, as this particular pandemic hit, that new system of healthcare delivery or public health delivery was really tested, and it's proven out to be pretty effective. And I'll say some of it's because of the governance model, but an awful lot of it is just because of the great people. Dr. Dannenhoffer, that's going to talk here in a minute, is certainly one of those people that has risen to the top and led through this. Teresa Metzler, who's the executive director for DPHN, when she was hired, there was 5 or 6 employees, and again, a relatively moderate, predictable amount of work to be done. Now I think there's over 30 employees over there, and she's done some amazing work continuing to provide all this work through the pandemic that Dr. Dannenhoffer is going to talk about. So I went back and looked at the board of directors for the Douglas Public Health Network, and we've had some change in the board through the years, but there's a few of us that have been on there since the beginning. And really the structure is organizations have board slots. So the hospital, there's 2 coordinated care organizations, ADAPT, Advantage Dental, and the Community Action Network, all have, and Aviva, all have, that's the Federally Qualified Healthcare Center, they all have board slots. So the people change, but the organizations don't. And an important part of that governance model is that there's over in those organizations they all have a mission of their organization is the health of the public. If you added all their board of directors together, that's over 70 community members that now have a vested interest in public health. And I think through this pandemic, not one time have I ever called an organization or we ever needed help from somebody where we've gotten no as the answer. So I think that community strategy of dealing with public health and working together has proven to be pretty valuable during this pandemic. I could go on and thank literally dozens and dozens of people for the amazing work that they've done so far and continue to do. But I do want to leave time for Dr. Dannenhoffer. He's got a great PowerPoint presentation and is, again, doing amazing work on behalf of the county. So, Doctor, I'll hand it over to you.
All right. Well, thank you very much. Great. So, Alan, do you have that PowerPoint going? All right. So this is Dr. Bob Dannenhoffer. I'm the Public Health Officer. And we'll talk about COVID today. I think I pretty much lived COVID over the last 8 months, and COVID is great. So we can go to the next slide. So people may remember at the beginning of this pandemic, there was a bunch of fear-mongering. And this, the CDC says Douglas County is one of the 4 worst counties to be in during the COVID-19 crisis. They saw Douglas County as an area that had a lot of older people. We had a lower income level. that we had no big tertiary care hospitals within our county, and that we could really easily be quite overwhelmed. If you see the bottom of the slide, it said 60% infected over 6 months, which would give us 60,000 infections over 6 months, which would clearly overwhelm us. And so at least at the beginning, there were some very dire predictions overall about COVID, but especially dire predictions about Douglas County. Head of the next slide, please. Well, the world situation today is that this still is a very active pandemic in most places in the world. You know, really, India, Brazil, Argentina, and the US have had so many cases. Over the weekend, there were 400,000 cases in a single day. I mean, compare that to 80,000 cases total in China to 400,000 cases in a single day. And South America has been especially hard hit. So not just Brazil, but Argentina, Chile, Peru, Ecuador have all seen huge number of cases. Europe, which had a lot of cases back in the springtime, but then had not very many cases over the summer, are now seeing a massive resurgence. At the same time, we're seeing a lot of cases in those places. Australia, New Zealand, Taiwan, Hong Kong, South Korea have done incredibly well. They've had less than one case per million population per day. So while as the United States has averaged over 40,000 cases, those areas have had less than one case per million population per day. That would be as if the US had 300 cases a day rather than 40,000. So the world situation is varied. Some places doing quite well, other places really struggling. We can get the next slide, please. So the next slide is a heat map that shows in increasing levels of red the areas that have really struggled. And you can see on this that Argentina, Brazil, Peru, the United States have really struggled. And over the last week or so, France and Spain have struggled. But large parts of the world do not have much disease, including much of Africa. Now, we don't know in Africa if that's because there isn't much disease or they just can't find it. But when we look over to Australia, Hong Kong, South Korea, Japan, they have remarkably low levels of disease, and they've done pretty well. Let's go to the next slide here. So the next slide, in the US, we've really had what we call rolling hotspots. So early on, this was really hot in the Northwest, in Chicago, and in Seattle. Those places then cooled down. Then we went to Texas, Arizona, and Florida. Those cooled down. And currently, the hotspots are in the upper Midwest, especially Wisconsin, the Dakotas, Minnesota. And through all of this, Oregon has been relatively spared. So if you look at the attack rate, that is the number of cases per million, Oregon has the fourth lowest attack rate of any state and the lowest attack rate of any state with a sizable population. And Douglas County has one of the lowest attack rates within the state of Oregon, which has a low attack rate. And so we in Douglas County are the only large county that's been able to open schools. And if we were a state, we would have far and away the lowest rate of disease and death of any state in the country. So Douglas County has done better than Oregon as a state. Oregon as a state has done better than almost all states in the country. So we have been relatively spared here in Douglas County. Some of this is luck, but you'll see later on, some of this is good work. So I go to the next slide, please. This is a map of the United States. And if you look here, you'll see little cones where the disease starts to show up. So again, starts in New York, Louisiana after Mardi Gras, some cases in Ohio. But if you look, the only two places that haven't had these spikes are Southwest Oregon and Northern Maine. So you look around in the middle of August, really lots of disease in Texas, Louisiana, Georgia, and Florida. By September, you're starting to see more and more cases in the Dakotas and Wisconsin. And by October 13th, what you see is that, again, Northern Maine and Southern Oregon relatively spared. So go to the next slide, please. So what did we do on this? Now, again, some of it is good luck, but some of it is a lot of hard work. So we were the first county to do drive-through testing. We started back in March. We've done 70 or so of these. Every Tuesday and every Friday, there's me or somebody else out there swabbing noses. And so I did it on Friday. We did 27 of these on Friday. And again, this testing has allowed us early on to know who had disease and who didn't. Because one of the striking things about COVID is that it's not that different from the regular junk that people get all the time in the first week or so. And it's only in the second week where people develop the severe pneumonia and the respiratory distress that makes it different. Well, if you wait until people are hospitalized, you have lost the game, because the incubation period is shorter than the time between first illness and severe illness. So the incubation period is typically 5 or 6 days. And the time from you getting sick to the time you wind up in the ICU is 8 or 9 days. So if you wait catch people until they're in the ICU, you're almost 2 incubation periods behind. We're also now doing drive-through flu clinics where we're giving free flu vaccine. We did one last week, gave over 100. We're hoping to do more again on October 30th and November 11th. These are going to be drive-throughs under the grandstands at the fairgrounds, and we're really encouraging everybody this year to get a flu shot. Next slide, please. We've done a couple of other things. We've had a hotline. It's been open every day since mid-March at 541-464-6550. This is staffed by community members. And while other counties and other places in the country say nobody will take our call, in fact, almost no one refuses our calls. And we've been incredibly good at reaching out to people, and people reach out to us. So just this weekend, we got some tips onto where there was an outbreak of disease, and we were able to stop that just as it happens, rather than waiting a week or two to get there. We had our community-wide emergency operations center that Tim talked about. We're also the first county to use these Binax Now rapid testing you'll see on the slide there. These are little cards. They can be done in the office. They don't have big requirements for machinery or for training. It takes about 10 minutes to learn how to use these. They're really quite accurate, probably 90% sensitive and specific. And through the CARES money, the feds were able to buy 150 million of these. And Oregon is going to get 1 million of them. We've already gotten 6,000, and we expect to get about 60,000 between now and the end of the year. So these have been great. These will really allow us to know how to do it. So other counties are just sort of thinking about what to do. We were able to, because of our arrangement, set up a Binax team, and the Binax team has already been out through the county distributing these to offices in the county. We expect to distribute more, and we're going to be working with Lane, Coos, and Curry County to distribute the Binax to their areas. I think Douglas County was recognized as having their act together, and so the governor asked me to serve on the governor's medical advisory panel. This is a group of about 10 of us that meet every Tuesday morning with the governor. And she said early on, really, what I want you to do is just tell me the truth about what's going on. And boy, this group doesn't hold back. So they've come up with some ideas at the state that were a little screwy. And I will tell you, this group really speaks its mind about what's going on. And actually, it's had a lot of influence on what's happened. So I think since our group has started meeting in the summertime, I think what you've seen is the stuff that's come out from the state has really been pretty well informed, because they really do have people who are willing to cry, you know the word. The other thing that we were asked to serve as the Healthy Schools Reopening Council. So there's several of us from the county that are on this Healthy Schools Reopening Council, setting guidelines for opening schools. Now, reopening schools is very complicated because you want to do it safely. If you don't do it safely, parents won't feel comfortable sending their kids. Teachers won't feel comfortable going to school. On the other hand, if you chose to be perfectly safe and never had a case at school, you'd never open schools. And we recognize that schools are so important for kids, for the education, for the socialization, for the meals, and for the other things that they get at school. And finding that balance has been difficult. And I have spent numerous hours working with the superintendents, working with the Oregon Department of Education and Oregon Health Authority to just find that exactly right balance. Go to the next slide, please. So let's revisit that article from the News Review. So the 4 counties that were mentioned were Marion County in Florida, Highlands County in Florida, Mojave County in Arizona, and then Douglas County. So these are all about similar sized counties. And you can see Marion County had 10,000 cases and 334 deaths. Highland, 2,400 cases, 100 deaths. Mojave County, 4,000 cases, 228 deaths. If we had 100 or 200 or 300 deaths in this county, that would so impact all of us. You know, when you do the 7 degrees of separation in the world, in Douglas County, it's 1 or 2. Almost everybody we know either directly or know through somebody else. So if we had 100 or 200 or 300 cases, that would be problematic. On the day that I pulled this, Douglas County had 301 cases and 4 deaths. So what I say in this is the CDC got it 3/4 correct. I think in those other counties, they really have struggled. Douglas County, not so much. And again, some of this is good luck, but a lot of this is the preparedness and the fact that the county altogether came together to make this work. And so it really is truly remarkable. I think when the story of this pandemic gets written, it's going to be, why was it so uneven? Why did Marion County have so many cases and so many deaths, and Douglas County have so few cases and so few deaths? So people have asked me to predict how this will go in the future. And when asked a very difficult question like that, I really look for those really brilliant people of our times. So I can get the next slide here. So I truly like this Yogi Berra from the Yankees. It's tough to make predictions, especially about the future. And indeed, it really is difficult to make predictions about the future on this, because the predictions have been anywhere from, well, we'll be done with this by mid-July 2020, to other predictions that we'll still be struggling with this in 2023 or 2024. Well, let me tell you, there's some good news and some worrisome news. So the good news is we have gotten so much better at treating this disease. So early on, when this disease was rampant in New York and in Europe, they had death rates of over 20%. So if you were admitted to the hospital, 20% of the time you died. But we've got some new therapies, especially remdesivir, hopefully the monoclonal antibodies, and just some of the things we've learned about the disease, about the clotting problems with this, the issues with ventilating these patients, and we've gotten better at it. So that most areas have been able to bring the death rate for hospitalized patients from the 20s to less than 10%. So that's great. The other thing is we're making really good progress on the vaccines. There are 4 vaccines out there that are in phase 3 trials. That's the final trials that you need to do before they can come out to the public. We still don't know how protective they've been, but we think through models that they'll be moderately protective. However, you know, they're relatively new vaccine models. So 2 are adenoviral genetic vectors, and the other 2 are mRNA viruses, vaccines that we've not used a lot yet. And so we've got to see how this is going to come out. But I think we wouldn't expect these to be widely available until at least opening day 2021. And then even when we get the vaccines, it's going to be a few months until enough people are immune so that the rate of disease will really decrease. Now, one of the worrisome things is that winter is really tough for respiratory viruses, and Chile and Argentina, being on the other side of the equator, are either 6 months ahead or 6 months behind us. If they are 6 months ahead of us, this is going to be a terrible winter. They had very low levels of disease until their winter started, and they've now had 4 or 5 months of just staggeringly high rates of disease and staggeringly high rates of death. And so we follow them, and we start now in October, November to have high numbers of cases. We could have a really tough winter. And so the things that we're asking people to do, there's not rocket science here. We want people to get a flu vaccine so that there won't be much circulating flu. We're asking people to be careful about gatherings. Just a story this morning of a big group of people who were infected. And they said, geez, we're pretty good at wearing masks. But when we dug a little deeper, they had a big family reunion with 30 people from around the country and around the state, including people from Utah, where the disease is rampant. There were people there who were sick, And now everybody in that group is sick, and they've spread it to people at their workplace, and they've likely spread it to school-age kids, and they'll spread it to the schools. So again, not rocket science about what we need to do, but we have to be really careful about interstate travel, because again, our rate of disease is lower than anywhere except for northern Maine. And so anywhere you come from, you're likely to bring more disease here. And then be careful about gatherings, because a gathering of 30, you don't know which one is going to be a super spreader event. Probably less than 1% of gatherings are super spreaders. So you can go many, many times without having a spread at a gathering. But if you do have a spread at a gathering, it can spread to lots and lots of people. So again, we're still not through this yet. And we really want people to be cautious about the upcoming upcoming months. So be careful about travel, be careful about gatherings, careful about wearing masks, stay safe, and be kind. Thanks.
All right. Thank you very much, gentlemen. Much appreciated. It looks like you guys were very thorough and informative. I don't have any questions that have come through, so it looks like we'll close things up now. And again, just like I said, once again, thanks to Commissioner Tim Freeman and Dr. Bob Dannenhoffer for joining us today and giving us this important COVID-19 update. Obviously, there's not a single business or individual who's not been affected by the pandemic, and we appreciate the information that you've shared. Even more, we appreciate the immeasurable work that you and your counterparts and teams have done on behalf of our county and community during the pandemic. I want to extend thanks again to CSO Financial and to Mary and Matt Inscore and their team for sponsoring today's program. Thanks to our virtual attendees for being here today. We look forward to seeing you at our November membership program, where post-election, our guest presenters will take a look at what we can expect to see from the Oregon Legislature and the United States Congress in 2021. So that ought to be a fun one. Until then, everyone take care, be safe, and do what Dr. Dannenhoffer said. Please have a great week. Thanks, everybody.